Top 30 Hospital Porter Interview Questions and Answers. Welcome to this essential guide on the top 30 hospital porter interview questions and answers. Whether you're preparing for your first healthcare support role or aiming to join the NHS, these questions will help you get ready to impress your interviewers. From handling patient care to managing high-pressure situations, we've covered everything you need to know to boost your confidence and perform your best. Let's dive into the most commonly asked questions and how to answer them effectively. 1. Tell us about yourself and your experience relevant to this role. I am a dedicated and reliable individual with a strong work ethic and a genuine desire to help others. My background includes working in fast-paced environments where punctuality, communication, and physical endurance were key. I have experience in manual handling, dealing with the public, and maintaining professionalism under pressure. I take pride in being organized, calm, and supportive, especially in challenging situations. I believe these qualities align well with the responsibilities of a hospital porter, and I'm excited about the opportunity to contribute positively to patient care and hospital operations. 2. Why do you want to work as a hospital porter? I want to work as a hospital porter because I'm passionate about making a difference in people's lives, even in non-clinical roles. Hospital porters play a crucial part in ensuring patients receive timely care and support by facilitating smooth hospital operations. I enjoy helping people, staying active, and working in a team-oriented environment. This role offers the chance to contribute to patient well-being while utilizing my interpersonal and physical strengths. I'm motivated by the thought that my work can ease someone's hospital experience and support medical staff in delivering quality care. 3. What do you know about the responsibilities of a hospital porter? A hospital porter is responsible for transporting patients, medical equipment, samples, and supplies throughout the hospital. Duties also include moving deceased patients with dignity, ensuring infection control standards, and supporting hospital departments during emergencies. Porters assist with lifting, transferring, and maintaining patient comfort during transportation. They also help prepare rooms, deliver meals, and respond to requests promptly. Communication, confidentiality, and physical stamina are essential. Ultimately, porters ensure smooth daily hospital functions and provide vital support that allows clinical staff to focus on patient care. 4. How would you handle the pressure of working in a busy hospital environment? I manage pressure by staying calm, focused, and organized. In a busy hospital, it's important to prioritize tasks based on urgency and safety. I maintain clear communication with colleagues and follow protocols to avoid mistakes. I also remain flexible and adaptable, understanding that emergencies may change my planned schedule. Taking short mental breaks when appropriate helps me reset and stay effective. My previous experience in fast-paced settings has prepared me to multitask while staying professional, efficient, and respectful to patients and staff alike. 5. Describe a time when you helped someone in a stressful situation. In my previous job, a colleague became overwhelmed during a busy shift. I noticed their distress and offered to share their workload temporarily while calmly encouraging them. I helped prioritize their tasks and assisted with customer interactions so they could take a brief break. This support helped them regain composure and continue effectively. This experience taught me the importance of teamwork, empathy, and staying level-headed under pressure, skills that are vital in a hospital environment when supporting both patients and colleagues. 6. How do you prioritize tasks during a busy shift? I start by identifying urgent and time-sensitive tasks, such as patient transfers for surgery or emergency sample deliveries. I then organize my schedule based on hospital priorities, safety protocols, and team instructions. Clear communication with supervisors and colleagues helps avoid duplication and ensures smooth coordination. I remain flexible, understanding that emergencies can shift priorities instantly. I use checklists or notes to stay organized and focused. By balancing efficiency with compassion, I ensure each task is completed properly, without compromising patient care or safety. 7. What steps would you take to ensure patient dignity and safety? I always address patients respectfully, explain what I'm doing, and ensure their comfort throughout any transport. I maintain their privacy by covering them appropriately and avoiding unnecessary exposure. I also follow proper lifting and handling techniques to ensure physical safety. I listen attentively to any discomfort they express and respond with care and reassurance. For vulnerable patients, I remain especially patient and gentle. I also respect cultural or personal preferences and uphold confidentiality at all times. My aim is to provide a secure, respectful experience for every patient I assist. 8. How would you deal with a distressed or aggressive patient? I would remain calm, speak in a gentle and respectful tone, and avoid confrontational language. I'd listen carefully to understand their concerns, showing empathy and patience. If the situation escalated, I would follow hospital protocols by alerting the appropriate medical or security personnel, ensuring everyone's safety. I understand that patients may be in pain or frightened, and I never take aggressive behavior personally. My goal is always to de-escalate the situation, protect the individual and others, and support the patient's needs as professionally as possible. 9. Are you comfortable handling deceased patients respectfully? Yes, I understand that handling deceased patients is a part of the hospital porter's duties. I would treat each patient with the utmost dignity and respect, following all hospital guidelines and protocols for transferring bodies. I would be discreet, compassionate, and professional, acknowledging the emotional weight of the task. I understand the importance of preserving the family's trust and the hospital's reputation during such sensitive moments. My approach would be calm, careful, and in full compliance with health and safety standards. 10. How do you ensure infection control while moving equipment or patients? I follow strict hygiene protocols such as proper hand washing, wearing gloves or PPE when required, and disinfecting equipment before and after use. I avoid cross-contamination by using separate equipment for infected and non-infected areas and disposing of any hazardous waste according to guidelines. I also report any breaches in cleanliness or equipment faults immediately. My role in infection control is crucial for protecting vulnerable patients, staff, and myself. By following procedures consistently, I help maintain a safe hospital environment for everyone. 11. Describe your physical fitness and ability to handle manual work. I'm physically fit and capable of handling the demands of a hospital porter role. I have experience lifting, pushing, and maneuvering heavy equipment and patients safely using proper techniques. I'm accustomed to being on my feet for long hours, working shifts, and responding quickly to tasks throughout the hospital. I understand the importance of posture, safety, and team lifting when necessary. I maintain my stamina through regular exercise and healthy routines, which helps me stay energized, alert, and ready for physically demanding tasks across long shifts. 12. How do you manage confidentiality and patient privacy? I understand the importance of maintaining patient confidentiality at all times. I never discuss patient details with unauthorized individuals and follow data protection policies strictly. During patient transport, I avoid discussing their condition, and I ensure their documents, charts, or labels are not visible to others. I always treat private health information with respect, whether it's verbal, written, or visual. Patients deserve dignity and trust, and I take my responsibility seriously in upholding their privacy and complying with NHS confidentiality standards. 13. Can you work shifts, nights, weekends, and holidays? Yes. I am fully flexible and understand that hospital porters are needed 24/7, including nights, weekends, and public holidays. I'm comfortable working various shifts and adjusting my schedule to meet operational demands. I thrive in structured routines, but am also adaptable to last-minute changes. I value being part of a team that supports patient care continuously, and I'm committed to contributing during busy or challenging periods when the hospital needs reliable staff. My priority is ensuring patients receive timely assistance, no matter the hour. 14. How do you communicate effectively with nurses and other medical staff? I maintain clear, respectful, and timely communication with all hospital staff. I listen carefully to instructions, confirm understanding, and ask questions when clarity is needed. I use appropriate channels such as radio, handover notes, or direct verbal updates depending on the situation. I understand that medical staff are often under pressure, so I keep my messages brief, relevant, and professional. Building trust and reliability through good communication helps the team work smoothly and ensures tasks like patient transfers or specimen deliveries are handled safely and efficiently. 15. Have you ever witnessed an emergency? What was your reaction? Yes, in a previous role, I witnessed a colleague collapse suddenly. I stayed calm, quickly called for emergency assistance, and followed instructions to ensure their safety until help arrived. I kept bystanders away and provided relevant information to the medical team when they arrived. My focus was on staying composed, following procedures, and supporting others during the incident. I believe my quick response helped reduce the risk to my colleague. This experience reinforced the importance of readiness, calm thinking, and teamwork in emergencies, qualities essential for a hospital porter. 16. How would you respond if you were asked to do 2 tasks at once? I would assess the urgency and importance of both tasks and communicate clearly with the relevant staff members. If one task is more critical, like an emergency patient transfer, I would prioritize that. If both are equally urgent, I would notify my supervisor for guidance. I always stay calm, organized, and polite, ensuring expectations are managed. I understand that hospitals can be unpredictable, and flexibility is key. By maintaining clear communication and time management, I ensure that both tasks are handled efficiently and safely without compromising service quality. 17. What would you do if you noticed a safety hazard while transporting a patient? Patient safety comes first, so I would stop immediately to avoid risk. I'd calmly explain the delay to the patient, secure them in a safe position, and then address or report the hazard depending on its nature. If it's something I can fix safely, like removing an obstruction, I'd do so. Otherwise, I'd call for assistance or report it to the appropriate team. I'd document the issue if required. Being proactive in identifying and reporting hazards is essential to maintaining a safe hospital environment for patients, staff, and visitors. 18. Describe a time you worked as part of a team. In a previous role, I worked in a logistics team where we had to unload and sort large deliveries on tight deadlines. We communicated constantly, supported each other physically and mentally, and adapted roles when someone was struggling. By working collaboratively, we finished ahead of schedule and avoided errors. I've learned that teamwork is about trust, communication, and shared responsibility. In a hospital setting, I would apply this same attitude, being dependable, respectful, and supportive of my colleagues to ensure the best outcomes for patients and staff. 19. What would you do if you didn't know how to operate a piece of equipment? I would never attempt to use equipment I'm unfamiliar with. I'd ask a trained colleague or supervisor for guidance and, if required, request training. Patient and staff safety are too important to risk making a mistake. I believe it's better to admit gaps in knowledge than to guess and potentially cause harm. I take learning seriously and would make sure to familiarize myself with the equipment afterward. Hospitals rely on staff being competent and safe, so I would always take a cautious and responsible approach. 20. How would you respond to a family member asking for information about a patient? I would politely explain that I'm not authorized to share any patient information and suggest they speak with the relevant nurse or doctor. I understand that family members may be anxious, so I would respond with empathy while respecting confidentiality. I'd offer to help them find the right person to talk to, ensuring they feel supported without breaching hospital policies. Protecting patient privacy is a legal and ethical responsibility, and I always act within those boundaries while still offering assistance in an appropriate way. 21. Tell us about a time when you went above and beyond in a previous job. In my previous role, I noticed an elderly visitor struggling to find the right ward. I stopped what I was doing, walked with them across the building, and waited until a nurse came to assist. Though it wasn't part of my assigned duties, I believe helping others is always worthwhile. My manager later praised me for showing compassion and initiative. This experience reinforced my belief that small acts of kindness can make a big difference, especially in hospital environments where people are often stressed or anxious. 22. How do you stay motivated during repetitive tasks? I stay motivated by focusing on the importance of my role in patient care. Even if a task feels routine, I know it contributes to the hospital running smoothly. I also set small personal goals during shifts, such as completing tasks ahead of schedule or assisting colleagues where needed. Listening to feedback, seeing patients smile, and knowing I've helped someone all keep me energized. I remind myself that consistency and attention to detail matter, especially when lives are at stake. A positive mindset helps me stay engaged and professional at all times. 23. How would you handle a complaint from a staff member or patient? I would listen calmly without interrupting and show empathy toward their concern. I'd apologize if appropriate and try to resolve the issue quickly and professionally. If the complaint was beyond my responsibility or involved hospital policies, I'd escalate it to the appropriate supervisor or department. My goal is always to ensure people feel heard and respected. I would also reflect on the complaint afterward to improve my future behavior or service. Handling complaints gracefully helps build trust and demonstrates accountability, which is essential in healthcare settings. 24. Why do you think hospital porters are important to the NHS? Hospital porters are vital to the NHS because they keep operations running smoothly behind the scenes. From transporting patients safely to delivering specimens or equipment quickly, porters support both clinical and non-clinical staff. They help reduce delays, maintain cleanliness, and ensure urgent tasks are completed efficiently. By freeing up doctors and nurses to focus on care, porters directly contribute to patient outcomes. They also provide reassurance to patients during transfers. Their reliability, strength, and compassion make them an essential part of the healthcare team, often making a quiet but powerful impact. 25. What would you do if a patient vomited while you were transporting them? First, I would stop the transport, reassure the patient, and check if they needed immediate medical attention. I'd inform nursing staff right away and follow infection control protocols, such as using gloves and disinfecting the area. If the patient was stable, I would clean up using the correct equipment or request assistance from cleaning staff if necessary. Throughout, I would maintain a calm and respectful attitude to preserve the patient's dignity. After the incident, I'd report it according to hospital procedures. Reacting with compassion and professionalism in such situations is key. 26. Are you familiar with basic health and safety procedures? Yes, I'm familiar with core health and safety procedures, including manual handling, infection control, use of personal protective equipment, PPE, fire safety, and hazard identification. I understand the importance of maintaining a safe environment for patients, staff, and visitors. I always follow training and guidelines, such as lifting with proper posture, reporting spills or broken equipment, and using correct signage for wet floors. I take safety seriously and know that being vigilant prevents accidents and contributes to a smooth-running hospital. I would also be eager to undergo regular refresher training to stay up to date. 27. How do you make patients feel comfortable during transportation? I greet each patient with a warm, respectful attitude and explain where we're going and what to expect. I ensure they're comfortable and secure, adjusting pillows or blankets if needed. I engage in friendly, calming conversation if they're anxious and listen carefully to any concerns. I maintain a smooth, gentle pace when pushing wheelchairs or beds and avoid sudden movements. I also respect their privacy and dignity at all times. My goal is to make every patient feel safe, valued, and reassured, even during short transports within the hospital. 28. Describe a time you worked in a fast-paced or emergency environment. In a previous warehouse job, a major system outage caused delivery chaos. Orders piled up and pressure mounted. I stayed calm, communicated with my team, and took the lead in organizing tasks by urgency. I helped prioritize critical orders while supporting newer staff. Despite the stressful environment, we met our targets and received positive feedback. This experience taught me how to remain focused, work under pressure, and support a team. I know hospitals can be even more fast-paced, and I'm confident I can apply the same resilience and efficiency in a healthcare setting. 29. What would you do if you made a mistake while performing a task? If I made a mistake, I'd take responsibility immediately and report it to the appropriate supervisor. I would explain what happened honestly, take corrective action if possible, and ensure the issue didn't impact patient care or safety. I believe in learning from errors, not hiding them. I would also reflect on how the mistake occurred and seek advice or training to avoid repeating it. In healthcare, honesty and accountability are critical. Addressing mistakes quickly helps maintain trust and prevents minor issues from becoming serious problems. 30. Why should we hire you as a hospital porter? You should hire me because I'm reliable, compassionate, and physically capable of handling the demands of a hospital porter role. I bring strong communication skills, a respectful attitude, and a deep understanding of how vital porters are to hospital operations. I thrive under pressure, follow procedures closely, and work well both independently and in a team. I'm also eager to learn, flexible with shifts, and committed to maintaining patient dignity and safety. I take pride in every task I do, knowing that it directly supports patients and the wider healthcare team. That wraps up our list of the top 30 hospital porter interview questions and answers. Remember, preparation and a calm, caring attitude go a long way in this important support role. Stay confident, stay professional, and don't forget, the work you do truly makes a difference in people's lives. Good luck with your hospital porter interview.